We'll go ahead and get started, and I'm sure that the team will be able to let other people in as we get going here. But welcome to the February MAC meeting, the Mobility and Access Coalition meeting. Next slide. We'll just go over some housekeeping before we get started. I think that we're all pros at this now, but Zoom has a couple of different features. So when you register, you'll get a link to be able to open it in the app or in the browser. Next slide. If you have to join from your browser, there's a link that's clear at the bottom. It's a little hard to see, but you don't have to necessarily download the Zoom app. Next slide. And you also get a one-click number as well with your invite. So if you happen to lose internet connection during this meeting, you can click on that in your invite and be able to call in and listen. Since we have a panel discussion today, we don't have a lot of slides, so it would probably be worth just listening in if you happen to lose your internet. Next slide. So video helps with communication. So we ask that if you're trying to communicate and you can turn on your video, please do so. We also ask that people mute themselves unless they're speaking. You can also put comments in the chat if you don't feel comfortable raising your hand. The chat function at this point, can everybody please put their name and their organization in the chat? This helps us keep count of who's attending and follow up if we have any questions. You can also see the other meeting participants by clicking on the participant icon. And then also just a reminder, we are recording these meetings and we post them on our YouTube page, so you can share the recording with somebody who you think might be interested in the recording, or you can go back and watch something if you missed something. Or if you can't make one of these meetings, it's always a great opportunity to go back and watch meetings. Next slide. So we now have captioning ability. So just if you need captions, you can click on the three dots and then you'll have a pop-up window, and then you'll click on the top CC that says show captions. So if you need captions, you can turn those on now, and you'll be able to read what people are saying. Next slide. This is just a reminder for some of the new folks. So the Mobility and Access Coalition is an alliance of human services organizations, local government programs, transportation providers, and community members. And we're dedicated to transportation access for underserved populations. We believe that transportation is essential to accessing opportunity, improving your quality of life, and meeting your basic needs. On the right here, you'll see a pedal graph that has equity in the center. These are the social determinants of health, or a version of the social determinants of health. And we really believe that transportation is that connecting service that allows people to access all aspects of their life. Next slide. Today, this is the agenda that we have. So we are going to provide some updates, and we'll get into these a little bit more. Next slide. And then also, we are going to have a panel discussion on pathways to equity, support programs for underserved communities accessing transportation. So we ended up having one person drop out, but so we have three wonderful panelists today. And that center one is RTD. Sorry to next slide. So I'm going to go ahead and turn it over to Joseph for the Loteria update.
All right. Hi, everyone. I'm Joseph. So I'll be in the month of March hosting, or not hosting, but leading the Loteria Game Days, which will be happening on March 4th, 2 to 3:30 p.m. at the Lafayette Senior Center, March 10th from 5:30 to 7:30 at the Longmont Public Library, and March 17th from 9 to 11 a.m. at the Longmont Senior Center. And right now, so the Loteria Game Days are, I don't know if anyone here has ever played the game Loteria, but basically it's kind of like bingo. And it's like transportation themed. It's originally a game from Mexico, but and we kind of like reworked it so that the pictures and words are all related to transportation. And so we'll be having this kind of bingo type game going on in the start of the workshop. And then after that, we will have a Mobility 101 workshop where participants will learn about all the transportation options in Boulder County. So they'll be get educated, win some prizes, and this is our first time doing it, so pretty excited about it. The Lafayette Senior Center and the Longmont Senior Center will both be in English, but we'll have bilingual support for Spanish speakers. And then the Longmont Public Library will be in Spanish. So, yeah.
Great, thank you, Joseph. Next up, does anybody have any questions on the Loteria game nights or game days? Okay, next slide. So now we're gonna have a report out by Elaine and Melissa on the Winter Bike to Work Day. So Elaine, would you like to kick us off with the Winter Bike to Work Day update?
Sure. Thanks everyone who did come out for Winter Bike to Work Day. It was lots of fun. We had really, well, this insane weather meant a lot of people were out. So according to Dr. Cog, 3,000 people registered throughout the entire Front Range region, but they estimate about 5,000 people actually rode. Stations in Boulder were seeing frequently more than 300 attendees. So that's true for St. Julian Community Cycles as well as Boulder Chamber. And we've also learned that 958 of the riders who registered, so that's really close to a third of the riders, are from the Boulder area who did this. So really, all in all, a great day. We had a lot of fun at the Chamber location. City of Boulder was there. The City Police Department helped register bikes and distributed 116 U-locks. Topher Downham came by on his bike, and we were seeing people on rollerblades and people with their dogs, all sorts of entertaining things. Just it's always a very heartening, fun day. So enjoyed that, and we are already beginning the planning for summer. Of course, that is Walk and Bike Month, so we do more than just the single day of activities. And we're really hoping to see a lot of inclusion from people of all abilities through this. June 3rd, our group will be kicking things off with a special Elevated Connect Boulder meeting. And June 24th will be the Summer Bike to Work Day. Melissa, what do you have to add?
Yeah, I think Elaine shared some really great stuff. I agree. It was a really warm winter bike to work day, and honestly, being up that early and having it not be 13 degrees was pretty nice. But yeah, I joined the Oscar team, the Office of Climate Action, Sustainability and Resilience, with Boulder County for their second annual winter bike station, and we had a really good turnout. Lots of kids and families came by on their way to school, which was really fun. And it was just great to kind of merge the transportation and sustainability conversations into one. So yeah, I don't have much to add other than what Elaine shared, but really excited for Summer Bike to Work Day.
Great, thank you, Melissa. Did anybody on the call participate in the Bike to Work Day? I mean, other than Melissa and Elaine? I know Nick did. I see that thumbs up from Nick. Yeah. Anybody from the city, Melanie or anybody else? Did you all participate?
We had a staff person at the chamber. She was partnered with some of our planning folks that are updating the Boulder Valley Comprehensive Plan. So it was really great outreach. Anna Kramer was manning and fielding conversations and questions with the community and brought back a lot for us to understand and respond to about people's excitements or interest in various city transportation things. It's always a good year. We typically have our staff riding around, having a good time. It's one of the only times we really get to just enjoy along with our community all the work that we all do together throughout the year. So it was really great. And I think Erica Amador, who's one of our transportation planners, was riding along with our language access liaison, Manuela Cifuentes, with Topher Downham, who Elaine mentioned. He was in his adaptive bike. And so it was just really great that we could all move around as a city group and to all the stations, have a really good time. I heard a lot of good reports from Erica.
I
Great.
should add in one of the really fun elements that there were members of the Boulder Police SWAT team on bicycles, and they were just great guys. Nice to see them, and I really appreciated that effort to help break down any barriers the community might feel with the police. So, and how cool that they are all able to do their jobs on bike as well.
That is great. Thank you all for your updates. We'll go ahead and transition to the next topic. Next slide, please. So we just have a couple of quick updates for providers, and I don't think that Natalie from RTD was able to make it today, but there are three providers three services that I'll provide updates on. I'll put them in the chat as well, so you can directly go and check them out yourselves. So Cultivate Let's Go is looking for volunteers. I think that they are looking for other volunteers as well, not just volunteer drivers. But I think that they said that they're critically low on volunteer drivers. So if you want to help drive veterans to the VA hospital or the VA clinics, or of anybody who wants to be able to drive veterans and their families to medical appointments, then please reach out. The first link goes directly to their volunteer page. I think they're also looking for volunteers for like snow busters. So if you know of anybody who wants to clear sidewalks of their neighbors who can't clear their own sidewalks or driveways when we have a snowstorm, if we have a snowstorm, then you would be able to volunteer with them as well and help your community out. Next is with mountain rides. I believe last month I provided the wrong days, the wrong updated days. Oh, sorry, can you go back to the provider updates, Joseph? So mountain rides is actually operating on Mondays and Thursdays now. So we are working with Gilpin County to see if we can get some funding to go farther into Gilpin County. So we're working with the Mountain Mobility Working Group, which is a working group of the MAC. And we're trying to get letters of support. If you all know of anybody who could benefit from transit service between Nederland and Gilpin County, please reach out and let us know. This will be a good opportunity to strengthen connections, and hopefully we could expand the number of days. We don't know exactly how many days we would be able to expand it to, but we're looking forward to tapping into some state funding from the Clean Transit Enterprise that would help us probably go up to 4 days a week, 5 days a week at least. So really great movement on mountain mobility. And last but not least, RTD is in their service change period. So they have their public meetings posted on their website. So if you want to have your feedback considered in the service changes, please attend some of those meetings. Next slide. And last but not least, I wanted to invite all of the MAC members to the May 12th CASTA conference. There's going to be a mobility summit, and we're going to be inviting all of the local coordinating councils from around the region to the Mobility Summit, and that one will be free. We will be able to provide lunch for people who attend from our local coordinating council, the MAC. But I'll go ahead and put the link in the chat. I don't believe that registration is open yet, but there is going to be a separate registration just for the Mobility Summit. You're definitely encouraged to attend the whole conference if you want to, but it's not often that we get the CASTA, the Colorado Association of Transit Agencies conference here in Boulder. I think the last time we had it here in Boulder was in 2015 or maybe 2014 spring, it's probably 2015 spring. So it's great transit access, and it's that new conference complex that's on Broadway. So just wanted to let y'all know, there's gonna be some fun tours of VIA Mobility Services and possibly going to Boulder Junction, and we're just working with the local host agencies to be able to have it be a fun event. Next slide. Okay, before we get started with the panel discussion, does anybody have any quick updates from their organizations that they would like to share before we jump into the panel discussion?
Hello.
Hi, Belinda.
Hi. Let me see if I can put this on. Okay. Okay. I do have an update. I don't know if you know, I don't remember. We are on a wait list. So DVR is on a wait list. So what that means is anyone who wasn't in a plan is put on the wait list. We really can, we still are taking, initial engagements. And then we request the medical records and make them eligible. But once they're eligible, then they're put on a wait list. So we can't provide any services at all until they're off that wait list. And the way they get off of it is according to category disability. The most severe will be looked at first and according to application date. So just wanted to give an update on that.
Thank you very much. Do you have an estimate on how many people you all typically serve?
No, there's not an estimate on that. It's whoever was in a plan is who we're serving.
Yeah.
So whoever was already in a plan before the wait list started is everyone that's being served. And then the way people come off is there's gonna be a time when like RSA is gonna say, okay, you can have 50 people or 100 people. And then the counselors will be notified, and then the counselors will reach out to the people that are in delayed status, on that wait list. But I don't really know. That's just kind of what they've told us. I just know that we're on a wait list right now, and anyone that wasn't in a plan of employment is waiting. So we still have our caseload. They just are in delayed, and we can't, engage with them.
Okay. Yeah, well, thank you, Belinda. I know that that's an incredibly important service for people with disabilities accessing employment. So thank you for everybody that you serve, and we'll definitely spread the word that there's a wait list now.
Okay, thank you.
Thank you. Are there any other updates that you all would like to make before we get started with the panel discussion? Okay. Well, go ahead and let's go to the next slide. It looks like Kevin is still running a little bit behind, so we'll go ahead and get started without him. But I'm going to go ahead and introduce the panelists that are here one at a time. So Colleen Samuels, she's the executive director of the Denver Regional Mobility and Access Council. Colleen, could you introduce yourself and tell us about how your organization serves the public?
Absolutely. Thank you, Angel. Good afternoon, everyone. I'm Colleen Samuels, and I am the Executive Director for the Denver Regional Mobility and Access Council, better known as Dr. MAC. We are a regional nonprofit focused on improving mobility and removing transportation barriers across the Denver metro area and, well, surrounding areas. Dr. MAC doesn't run a transportation service, but instead we bring partners together, such as transit providers, local government, similar to Boulder MAC, nonprofits, healthcare providers, and community advocates to better coordinate and address some of the service gaps, mobility issues in our communities. Our work centers on mobility management, regional collaboration, information assistance, and travel training primarily. And the goal is to expand equitable access to funding. And I'm so happy to be participating in this panel today. And I want to just kind of apologize in advance. My internet has been a little spotty, so I may be turning my camera off occasionally, but thank you so much for having me.
Thank you, Colleen. We appreciate you being here. And let's go to the next slide, please. So Alexandra's joining us today from RTD. We know that RTD has a lot of different programs. So I'll go ahead and turn it over to you, Alexandra, to introduce yourself and talk about how your organization serves the public.
Hello, my name is Alexandra Nira. I'm the special discount programs supervisor here at RTD. And Regional Transportation District, we are a public transit agency that provides safe, reliable, and accessible transportation to make lives better through connections. We partner with a lot of organizations like Dr. Mac, Dr. Cog, different community organizations throughout 8 different districts to work on making transportation more accessible, making it more reliable, and making sure that we are serving the public as best as we can. Thank you so much for having me, and it's really good to see some of you again.
Yeah. And for those of you who weren't able to attend, Alexandra, she led our lunch and learn on how to sign up for RTD Live. So we can share that link in the chat if you missed that. Last but not least, we're going to introduce Kevin. Kevin is with B-Cycle. Kevin, would you introduce yourself and talk about how B-Cycle serves the public?
Sure thing. Thanks for having me at this one. So my name is Kevin Kraus, and I'm the general manager of the B-Cycle bike share system in Boulder. For those of you who are sort of been watching this space for a while, the system here is about to turn 15 years old in just a few months. For its first roughly decade, it was owned and run by a local nonprofit, Boulder Bike Sharing. And then for the last little more than 5 years, we've been first under the umbrella of Trek Bicycle Company as our parent company, and then starting a couple of years ago under Bicycle Transit Systems, which is an operator of these public bike share systems across the country. And so basically we run the B-Cycle system. During the last 15 years, we've been growing it slowly but surely within Boulder. Sometimes that's involved grants, certainly when we were more of a nonprofit. And then that also has meant our own sort of private investment in the system along the way. We now have more than 400 all-electric bikes out on the street in Boulder at 65 different station locations over roughly, depending on how you measure it, about 6 square miles of the city. And we are actively working to expand both within Boulder and within the Northwest Metro region under a CAMP grant secured by Longmont. So we are very hopeful that this year we'll be officially growing B-Cycle into a regional bike share system here.
Great, thank you so much, Kevin. So I'm going to go ahead and ask questions. I'll change the order so that everybody gets a chance to go first. So I'll go ahead and start with Alexandra for this first question. So RTD has a ton of programs that support equity. What does transportation equity mean to RTD, and how do you all achieve that through your programs?
Thank you, Angel. Well, transportation equity is at the heart of the agency, and we are always looking for ways to remove barriers to access. We know, especially for underserved populations, there's a lot of barriers when we're talking about transportation. So the agency is always, looking for ways to help everyone, but especially underserved communities, have access to all of our services. The way we do that, we have created and implemented different programs, like, for example, the Live income-based discount program that was launched in 2019. So this is it's going to be 7th year. And it offers a 50% discount for low-income individuals. Programs like Access-a-Ride, which offers another option, transportation option for paratransit. Access on Demand, which is an on-demand service, also focusing on paratransit services. We a couple of years ago we launched with a grant with the support of a grant, we launched Zero Fare for Youth, which offers youth 19 and younger can ride for free. And all of these programs are based on, studies that RTD conducts in the community in reference to equity, fair analysis, what the community is needing at certain points. So we, as an agency, that's equity is at the core of our mission, and we are always striving and working to provide services to make sure that we remove any barriers, any possible barriers. Of course, there's a lot of barriers, and we cannot, target all of them, but at least we are always working on implementing programs to help remove those barriers. And these are just a few examples of the programs that we have available. And we're always, again, looking at the routes to make sure that we are serving those communities that are in need with routes that are accessible and are appropriate for that sector. And we are always looking for different options and improving the programs that we already have.
Thank you very much. You all do so much for the community. It sounds like we have an echo. Is that still the case, Elaine? It says better.
From me?
Oh, just in general. I think
Oh.
there's an echo. I thought it was because my mic was on, but we'll go ahead and continue. Thank you. So Kevin, we'll go ahead and transition to you. For B-Cycle, what does transportation equity mean to you, and what programs do you have to support equity?
Sure, thanks, Angel. I think for us in the bike sharing world, transportation equity largely looks like that everyone who can access and wants to access the bikes is able to do so. Being mindful of cost as a barrier or knowledge of bikes, familiarity, comfort with them. And then also thinking too of the physical requirements to be able to balance and use an electric bike. On that last point, we really do just have one model of bike that does require the balance to be able to ride it. And so we're mindful that we're not serving everyone, all abilities with that. That's something we're actually working on trying to expand. Bike share as an industry has sort of found a number of ways to try to address that need, but seldom has it looked ever like having different types of bicycles available in the same stations at the same time for the general public to use. So usually it's done via bike library or an on-demand model, and we're looking into both of those. In terms of cost access, I'm really happy to say that we are more than 5 years into a partnership with Boulder Public Library to have key fobs for B-Cycle available as library checkout materials. So anybody with a library card can go to, it's historically been just the main branch in Boulder, but that's going to be growing soon to all Boulder Public Library District branches, where any library patron can check out a bike share fob, use B-Cycle at no cost to themselves for a week for short trips. And then we've actually had our greatest success, I think, in the equity space via fairly extended partnership with Boulder Housing Partners, wherein all residents have had free annual pass access to B-Cycle also for a little more than 5 years now. And what's really been instructive about that program is it showed the importance of a long-term partnership and the communication that is needed to sort of implement something for durable behavior change longer term. Because we've had other grants that have sort of come and gone, and being able to sustain something with BHP not only as at the administrative level, but at the resident coordinator level, to know that this is a benefit you can communicate to residents has been really helpful. And I guess as a consequence, it means that our sort of last current program of equity access was simply a discounted annual pass for anyone who really attests that they would income qualify for that. We don't require any verification. Is actually fairly underused. We have an annual pass for our system. That means you can take as many B-Cycle trips as you want, up to an hour in duration before you get any other charges. And that pass normally costs $150 plus tax. We will offer it to somebody for $40 simply by them contacting us and requesting a promotion code for it. but it's not well used, in part because we have those other programs up and running. So I think we're really trying to make sure that that cost is not a barrier to someone for using these bikes, and that ideally that the access to the bikes themselves, seeing them around town and being able to then, for example, get a pass at the library, we want that to be something that's pretty inviting for people to be able to do.
Thank you, Kevin. Yeah, I think that the library checkout is an amazing program that y'all have, and it's definitely an example of thinking outside the box. I'm going to transition to Colleen. So how does Dr. Mack support transportation equity, and what does it mean to you all?
Yeah, so transportation equity to me, to my team, means your age, ethnicity, disability, income, zip code, or immigration status should not determine whether you can get to where you need to go. Whether it be work, medical appointments, the grocery store, community activities, whatever it is. It's a basic, I feel, human right for everyone to have access to accessible, affordable transportation. So the way that Dr. Mack, some of the ways we try to address the issue of transportation equity is we try to work with providers to support options beyond traditional routes or services, if possible. We work to try to strengthen paratransit, community-based transportation, and figure out other modes of transportation, if possible. We use mobility management to connect people to the right ride at the right time, and that's done through our information and assistance line, where we give provider referrals or try to connect them to the correct provider based on their individual needs. And most recently, our work is focusing on making sure rural and some of the smaller urbanized communities aren't overlooked. So one of the main things that I think is integral to our work is that we make and try to cultivate strong partnerships and community outreach, and just providing information to the community, whether it be in the form of our travel trainings or our tech trainings, because sometimes it's just because folks don't know, right? They don't know what's available. They don't know how to use the tools, may not even know how to use public transportation. So by providing that training, I think that kind of bridges that gap. We have our Getting There guide, which is currently approaching its 18th edition. It's been really popular, especially in the older adult communities. It's a free publication. It's doubled in size now, but if you call or email us, we can get you a copy over. It's free. And I think that's been helpful in providing options or making the community aware of their options. But I think finally, the advocacy piece, right? We're making a more concentrated effort this year to be in the communities, listening, to hear directly the barriers that each community is experiencing specifically, because we don't ever want to assume that we know what they need, right? I'm a huge believer in let them tell you what they need. Don't just go out and create this big program and then you haven't heard from the community. So I think that is, if I answered the question correctly, I think that's what it means to us.
That's great. Thank you, Colleen. And I
You're
put
welcome.
the link to the Getting There guide in the chat if anybody
Oh,
wants
thank
to
you.
get it. It has wonderful providers that are like nonprofit, public agencies, and for-profit. So there's a lot of options to look through there.
Thank you,
The next
Angel.
question, I'll start with Kevin. So you talked about some barriers or some ways that you got around barriers, like the library checkout or working directly with the low-income housing authorities. What barriers are you seeing from B-Cycle that are persistent with low-income and vulnerable populations to accessing your services?
Yeah. I think maybe to celebrate that we're seeing less fewer instances of someone being able to access a smartphone so that utilization of an app is an issue. So I think that's good that we've seen that barrier decrease over time, though it is still there. And we still allow people the option to request an RFID sort of key fob from us that prevents someone from, or rather allows someone who does not use a smartphone or is not banked in a traditional way to have that key fob and access the system. I think in terms of persistent issues, though, we attempt to operate a system within the constraints of it being intended for short trips, and really for us, that can vary by pass type. For most of our passes, that means either 30 minutes per trip from point to point, or 60 minutes if you're using like an annual pass. And for some people's trips, that's either not enough time, or if they're really relying on bike share as a transit system and need to go outside of the footprint service area of where we have stations today, it can mean that they're incurring cost to go lock that bike up somewhere else. And from the side of the system, that's helpful to us because it means that we do want to make sure that bikes are returned as quickly as possible and available for someone else to use, but it can mean that there's an additional financial burden to someone using it for that kind of trips. And we are aware that that does happen. There are people who want to rely on this really as their transit for everything, or as many places as they can realistically go. But sometimes it comes with a cost burden for it too.
Yeah, that's important. I mean, transit doesn't go everywhere, and people think of bikes as being flexible. So,
Yeah. And if I may, Angel, I'll add to that is just to name one issue of the people who are actually using the system. We're also aware sometimes, though not all that frequently, surveys are the most common place that this shows up, that there may be someone who chose not to use the system because they did not want to assume the financial liability that comes with checking out a private shared bike. And that's written into our user agreement, sort of understandably, as so many things are these days. And yet different people may look at that and think that it's an unacceptably high financial risk to have the bike checked out on their watch during their utilization of it.
yeah, that's great. I think just to follow up a little bit on like the smartphone aspect, what we find with Mobility for All is people might have smartphones, but they have shorter battery lives because they're older phones. And so they are afraid that it's going to die on them, right? So I think there's just so many other things besides just having, a credit card or having a smartphone.
Good point. And I think one positive of the dock-based bike share system is that in our world, you really only need the phone to check out the bike. And if your phone died during the ride, that is okay, you can still end it. But for the vast, vast majority of our riders, you need a working phone to check out the bike in the first place.
Yeah, thank you, Kevin. Colleen, I know that Dr. Mack does a ton, we've talked about it, but like, what are those persistent barriers that Dr. Mack is seeing for underserved populations, low-income folks with transportation?
I think the largest is that sometimes services are just hard to navigate, right? And so I think that's kind of primarily due to language, cultural barriers. There's sometimes different eligibility rules across different platforms and services. Try to figure that all out. And then there's digital access and literacy challenges. And we all know about the limited funding, but limited funding for non-emergency medical and essential trips. So I think those can be huge barriers for everyone, but primarily for when we see our older adults, people with disabilities, and people in the immigrant refugee communities. Just figuring out the system can sometimes be harder than the ride itself.
Yeah, that's a very valid point. Yeah, and I think we take for granted a lot of times, like.
Absolutely.
We create a brochure and we think everybody has access to it. So yeah, it's good to
Right.
recognize those barriers. Alexandra, I know that you oversee special discounts, and RTD is has such a large service area. Are there persistent issues that you all are seeing with your fare discount programs or specialty programs for low income and vulnerable populations?
Yeah, I think I would agree with what Colleen and Kevin said in terms of just, low digital literacy. I think I agree with you, Kevin. We have seen a decrease, but there's still a persistent barrier. Also, language barriers. We're trying to offer more assistance in other languages, but of course, there's always a barrier, not only with assistance applications, but also with, as Colleen mentioned, using the system. There's a lot of fear just because of the language barrier, not knowing the system. And that fear also translates, if we're looking at the application process, fear of the government, of the agencies, immigration status. So those are barriers that we see consistently. And even though we are implementing tools and support systems to help with that, it's those are barriers that seem to be constant. And also in terms of what we were talking about, digital literacy, even though they have a cell phone, it's just hard for them to navigate applications in English when English is not their first language. And also in terms of the application process for assistance programs, just difficulty finding documentation that is needed to to meet the requirements or to meet the minimum requirements of the assistance. And also people don't have time to get to learn the system and get to learn the processes, like follow up with applications, just because they're managing or juggling 3 jobs and family and childcare while facing all the other barriers. So I think those digital literacy and lack of knowledge of the system are 2 big ones that are always consistent.
Yeah, thank you very much. And thanks for raising the issue of just general fear and immigration status. I just wanted to point out that Laura said that they have bilingual digital navigator services with Sister Carmen to help people who need additional assistance in Boulder County. Colleen, I see that you have raised your hand. Would you like to respond to something that Alexandra?
Yeah, really quickly. Yeah, when Alexandra mentioned the fear issue, we're seeing that a lot. And so I just wanted to mention that Dr. Mack has implemented a safe call initiative where we normally try to collect as much demographic info as we can because of our funding. Of course, if someone calls and they say, I want to make this is a safe call, we're not going to ask any of those qualifying questions. We're just going to do our best to get you the services that you need, because we are seeing that there is, with everything going on, even more so, a huge fear with people not wanting to access services. So I just wanted to mention that, just in case anyone has someone they're working with in those populations and they're like, I don't want to call, they're going to ask my name and my background, and we're not. You just let us know from the beginning of the call that I'm requesting a safe call. Thank you. I didn't mean to interrupt. I know I went out of turn.
Oh, that's great. Actually, I was gonna have a follow-up question for you because I saw that notice that you just sent out. Thank you so much. So I know that you all have tried to overcome these barriers by like implementing programs that maybe are designed a little bit differently than what you had initially like envisioned, I guess. What are some of the lessons that you've learned and how to design programs so that they reach the intended population? And so, Colleen, I'll start with you on this one, but how do you like what are those barriers, or how have you overcome those barriers in how you design your programs, and what words of wisdom do you have for other people?
Yeah, I think Dr. Mack does a great job with reaching those communities, but I'm going to be honest and say there's a lot of work to do and a long way to go. But I think by the support with community-based mobility managers, just working to create those collaborations and those relationships and kind of extend our reach, and by providing hands-on technical assistance for people that may be that whole digital divide piece or just need the additional training. I truly believe that transit and human services providers need to work more closely together. I truly, truly, truly feel that. Like, because if you're going to see the biggest need, where you're going to see it in the human service arena, right? So I hope to bridge that we can, Dr. Mack can continue to help bridge that gap, make those services more accessible. And just by sharing tools with each other and resources with each other statewide. We have an area that because of our funding, we are limited to, but why can't we collaborate with someone in Colorado Springs or Pueblo to help bridge that gap and address those first mile, last mile issues that are such a headache for some folks? I just feel like, I'm going to say this and may anger people, but I do feel like there is a lot of silos in my mind going on, and you know what I mean? And we need a lot less of that. Like, let's just work together to fix this by strengthening our local networks instead of centralizing everything. Then solutions stay community informed and accessible, right? So I just hope that, I know we have a ways to go, but I just hope that I see it changing in my little bit of time in this industry. So I hope that it continues to get better.
Great, thank you, Pauline. Alexandra, like, have you all seen, or have you implemented tips or techniques that help you reach the populations that have persistent barriers?
And this comes from not only my experience at RTD, it comes from my experience in other nonprofit organizations that serve the community. I think what is key is, as Colleen mentioned, collaboration. We cannot do it alone. We need those partnerships with community organizations, with other agencies, not only to learn from each other, but also to have a better idea of what's going on the ground. So to me, that's one of the key elements when you're designing programs to serve the community, just, being constant connection with the community. And those, I believe that community organizations are the experts, and they are the ones who have those direct connections, and they are the ones who hear the needs firsthand. They are the ones who work with the community members to overcome all these barriers. So the collaboration is key. And also from my experience, flexibility. While you when you're creating a program, of course, you try to listen as much as you can, try to make it, as appropriate as possible to meet certain needs, but circumstances change, environmental things change, things change around our communities, and there's different factors that impact our communities at different times. So we also need to be flexible, of course, not to just start from zero again, but we also need to be flexible in terms of how do we make sure we are serving those specific needs that arise at certain times, and how does that translate into the programs that we have currently. Just maintaining that flexibility and that connectivity with the community is key.
Great, thank you so much. Kevin, I know that you've talked about some of your programs and how you've gotten around things like, people not having smartphones. If there's like one quick takeaway that you have for people designing programs to address barriers, what would you say that is?
We have tried to keep our programs as simple as possible, in part to just facilitate simple comprehension of them, but also to make the eventual translation of materials easier. We don't actually do a lot of translation, and we've only been working with translation into Spanish so far. But we realize that the simpler and more intelligible our programs are, the easier they'll be for first-time users to understand, and also easier to translate the materials.
Yeah, that's an important point. If people have to figure out how to get there and also like how to like use it and access it, like that's just a lot of variables, right? Yeah, thank you.
If-
Alexander, we're gonna start with
and
you.
Angel,
Oh,
I'm sorry.
okay.
Yeah, no, having worked at a hospital, I think that's another, I agree with you, Kevin, just making everything for fourth grade level. Just so not assuming that everyone understands things or information delivered in a certain way, but just keep it simple, simplified communication, and simplified systems are also key.
Yeah, thank you very much for that. Like, I think at the plain language training that we hosted last year, it'd probably be good to host it again this year. So, yeah, and there's also paperwork, right? I mean, I think that the labor, the administrative burden that low-income folks and people with other marginalizations like have to go through is a lot, right? It's not just one application for a disability discount card. It's, their Medicare, their Medicaid application, their like support services application. So it's just, kind of just snowballs, I guess, is what I'm trying. I think, and Alexander, we'll start with you on this one. I think you all have talked about partnerships a little bit and talked about like how you work with other organizations. Like for those partnerships, it's really challenging to have like mutually beneficial, like, because maybe transportation isn't always at the top of their priority. Can you give me some good examples of like how you've partnered with employers or nonprofits or other government agencies to strengthen your programs? And like, what are those techniques that you use to get an organization to understand that your issues with, transportation are also their issues? Alexandra?
Oh, thank you. I thought you said my name.
Oh.
I wasn't sure.
Okay.
So what we've been doing is creating really close relationships with different organizations. And what we try to do is meet them where they're at, taking advantage of their infrastructure, their reach, and we try to accommodate to what they're needing. Like we work with a lot of employers, with a lot of community organizations, and we have presence during their events. And we try to bring the information that they're looking for at that specific time, or that meets the focus of that specific event. So I think kind of being the listening partner and going the extra step to meet the needs of the organizations that we work with has been really important in developing those relationships. And again, listening to what their needs are, and in any area that we can help, at least informing their clients about different programs, or even, we have been going to different outreach events, not from our organization, but other organizations, to help, for example, sign up for, help clients sign up for, or go through the LIVE application. So kind of providing as many tools as possible. So we have that, two-side relationship where, we listen to their needs, and they also help us with input from the community and the needs that they see in the community.
Yeah, that's great. I think I've heard that, for transportation barriers for people who are just trying to make ends meet, it's not always like, people don't always recognize that it's a transportation challenge. It's getting to the food pantry challenge or getting to your doctor's appointment. So it's always kind of connected with some other sector, right? People just don't have transportation for transportation's sake, right? They really are just trying to get access their basic needs. So it's really, yeah, it's good that you're partnering with people who are outside of transportation to like get that
Yeah,
information.
and just a good example, I think, thank you, Angel. And we we work really hard to you know strengthen those relationships. A really good example, I think, it's the Transit Assistant Grant that was just announced. We had 180 applicants from government organizations, social services organizations, nonprofits. And the main goal of a program like that is to partner up with community organizations. And one of the asks that we have for them is just help us promote programs like Live, so we can work together to find long-term solutions for people who have transportation needs and have urgent needs like healthcare appointments and things like that. So I think that program is a great example of how we're trying to be creative to develop those partnerships and really make the best of those partnerships for both sides.
Yeah, thank you. Yeah, I think you might have a couple of the TAG recipients, the Transit Assistant Grants recipients on the call. I was really happy that you all implemented that. Kevin, we're gonna go ahead and start with you on this next question. So what strategies have you used to reach populations that you think can benefit from B-Cycle? Are there any specific outreach strategies or engagement strategies that you've implemented?
Yeah, I would say that in 2025, for the first time in quite a while, we sent postcards to addresses. And it sounds simple and something that used to be a little more common, but we were able to sort of locate by zip code or even within that and try to reach out. And one example would be in the Boulder Junction Access District area, where there is a special district where property taxes are paying for transit benefits, including bike share. We were able to just send a postcard to every address, and that would added a touch point beyond when someone first moves in and receives a welcome packet, or when their building managers are letting them know about that. And then we, at the very end of the year, with the city, and City of Boulder is obviously a very long-term partner of the bike share here, did one mailing of postcards in English and Spanish to 2 mobile home communities to explore what uptake would be of a free pass promotion code to utilize some nearby bike station locations. And I think what's similar about those 2 areas, even though they're different intended populations, is that it's taken a long-term partnership with the city to sort of engender the confidence back and forth both ways that B-Cycle will be here as a transit option for people in the months and years following a outreach effort. But that also, for our side of things, that we can partner in a sort of a durable way over time, that it's worth it for us to still, as a private company, take on the risk of installing our own newer equipment in an area to serve those populations.
Yeah, great. Thank you so much.
Yeah.
Pauline, for Dr. Mack, like what engagement strategies have been successful for your organization?
I think hosting our monthly meetings and attending different roundtables, try to get the information about what we do and listen to where there are opportunities for collaboration has been helpful. We try to we're a really small team, but I think we do a really good job of attending community events. So if we're ever invited or we hear everything, we do make our best effort to be there to kind of not only present our services, but to kind of listen and hear what they're seeing is a need. Most recently, we've started attending, like I said, we're a small team, so it's going to be a little bit of work, but city council meetings where so that we can be present to hear if anything regarding transportation barriers come up. So for example, like I attend the African American Commission in Denver and I believe it's the older adults. I can't remember if that's me or Steph, but each team member kind of attends to two meetings. And I think that's been helpful we just started it, but it's really been helpful with our outreach strategy and then offering our services free. I mean, our travel training and everything is free. So if we can get out there in the community and say, but this is free, you can get free, that usually draws the word free, usually draws folks in and is helpful with outreach. I think that just trust grows through consistency and shared ownership. So we're just trying to, I think, because we're so small, by building those relationships, like with the Voter Mac and DRCOG and other entities, if we can build that, then we don't have to be in the community as much, because if you all are out there and you hear something that we do or that we could help with, you can say, hey, Dr. Mac, how's that getting their guy? And vice versa, right? So I think that's been one of our strategies, just trying to grow our community base and our partnerships.
Yeah, that's great. Yeah, partnerships make the world go round, right?
Yep, absolutely.
Yeah. So Alexandra, for RTD, like, I know you have like different organizations that do different outreach strategies. You know, I know that Brandon's done like partnerships with libraries and reading on light rail and such. But are there specific outreach strategies that you've seen be pretty successful at reaching people who need to have more information about RTD's programs?
So from my side, and I think Gabriel from our community outreach department is here, and you know, he might have more insight for this question. But at least from our side, from the special discount side, I think I agree with Colleen. Just being present and being accountable. We, as much as we can, given our human power, because we're a small team as well, we try to be present where, you know, community organizations need us, and through those partnerships as well. You know, like just trying to be there, bringing the information that is needed. We have small cards with a lot of information regarding how to apply for the programs, you know, the routes, the applications that RTD has, you know, for tickets and the use of the system. We are also trying to we've been creating short videos to explain different programs and how to use the programs, and those are posted on our website. We are also working on translating those videos. We already did some translation in Spanish, but we are working to see if we can translate those videos into 5 more languages. So, you know, that's kind of outreach and engaging with the community and helping community organizations with tools so they can, you know, convey the same information. But more specifically with other community organizations, is basically being present as much as we can when we can, and always, you know, making sure that we are accountable. And if we say that we're going to be there, make sure that, you know, someone from our team is there.
Yeah, wonderful. And I mean, I guess that's an opportunity to plug 2 upcoming events that we'll put in the chat. But we have a live workshop at CPWD in Boulder this month, and then one in Longmont at CPWD next month. And I'm sure that we'll track down those and put those in the chat. But thank you for showing up and being a good community partner with us as well. So I think this next question, I'm going to start with, I think Colleen, I think it's your turn to start with you. How does Dr. Mac measure like success for your programs, right? I mean, there's so many different ways to measure success, but what do you all like tell your funders? What do you all like kind of, what are you the most proud of, I guess?
I think the feedback, we call them heart and hand stories, but the feedback, that's the biggest way, like having someone write a letter saying that they appreciate there was a community in Golden where the adults of the residents is assisted living, 2 facilities, where they were having a hard time getting transportation to and from the grocery store. Like in the transportation they did have would let them off like a block or more from the facility. Well, if you're an older adult, you're carrying bags. That's just not practical for everyone. It just didn't make sense. But by connecting with VIA Mobility Service, I love VIA, they were able to help us arrange transportation to those 2 communities. And then we received this, that was the most beautiful letter. Those are kind of things that sometimes I'm such a baby sometimes, but kind of made me cry because I'm like, yeah, that's a huge impact. So I would say feedback and from partners and writers, but when I see our regional collaboration growing stronger, that's a measurement of success for us. If I see that we are reaching improved access for priority populations, we're struggling with that a little bit because for the past, well, since I've been in this role, our the primary demographic that we serve, older adult white females. But seeing now that those numbers are coming in and our demographics are changing a little bit and our reach is extending, I think that's a good measurement of our success. Yeah, I think that's about it. I guess ultimately we'd all like to see the success would be that less people are falling through the cracks, right? And we can measure that less people are experiencing mobility and transportation barriers. That would be the ultimate measure of success.
Yeah, thank you. I love like the emphasis on the qualitative impact and just that feedback loop from partnerships and having strong partnerships.
Mhm.
Alexandra, how do you at RTD, like what do you all consider to be a success with the special discount programs?
So for us, there's different measures of success. One, of course, is if we're talking about the LIFT program, is making sure the turnaround time is within what we have set that time to be. So we don't have people waiting for their discount. Of course, on the other hand is ridership. For example, with the TAG program, is how many individuals were served with the tickets that were distributed to the organizations that were awarded, and how many tickets they distributed to that specific number of individuals. That's in terms of the discount programs and the programs that my department manages directly. And of course, on the bigger scheme of things, riderships, making sure that the routes that we have available are being used, et cetera, et cetera. But I think we are also using a lot more those impact stories. How our programs, specifically all of them, but in terms of the special discount programs, how those programs are impacting individuals in their daily living. So those have become very important for us, and we are always trying to include those testimonials in the information we present, not only to the community but to the board and to other stakeholders when we want to show how we measure and how effective programs are.
Wonderful. I don't know if you all oversee the Zero Fare for Youth, but I'm wondering if there's any way that you all are showing the success of that program, right? Because that's, it's not necessarily, people don't sign up for it. So I don't know if you have any,
Yeah, so another ways, we also kind of keep track of course, you don't need an ID or an RTD ID to use that program or ride our different routes through that program. But we, we have, thank you, Gabriel, but we keep track of, how many people are requesting those IDs And we have heard different testimonials about how impactful this service has been, not only for youth, because they are able to go to interviews, to go to jobs, but also for the caregivers of young people. Because, you know, like, it's one thing is if you have to pay for yourself as an adult, and then we had, for example, stories of a mom who was going to the grocery store but had, you know, like 5 young kids. And, you know, of course, you know, that becomes a really big barrier when you have to pay for 5 individuals to go buy groceries. So those that kind of impact is what we have seen. And Gabriel, thank you so much for chiming in. They are the ones who have been managing the Zero Fare for Youth since it started. So
Great, thank you. Gabriel, would you like to talk about how your organization, or you're in civil rights, right? How civil rights like really focuses on the impact of the Zero Fare for Youth?
Sure. Hi, everyone. I'm Gabriel Martinez. I'm a community engagement specialist with RTD in the communications department. Zero Fare for Youth is funded by the state legislature. And until recently, for about a year, we had a specific community engagement specialist. Some of you may have met her. Her name was Taylor Curtis, and her job was to community engagement specifically regarding this program. And so what we have done is we have, first of all, we have an event vetting tool called the Event Attendance Rubric, which, among other things, helps us capture information about how many young people to expect at any given event. So, for example, we might have an event that has 100 adults and 200 children, or 800 children, like if it's a touch a truck event. That's one way that we can keep track of how many kids that we are interacting with. But that's specifically with community engagement events. That doesn't necessarily capture how many people are coming onto our buses, our trains, Access Ride, that sort of thing. So while RTD does keep quite extensive data on ridership, it's been difficult to capture specific information about how many youth make up a percentage of ridership on any given route. So if any of you have any ideas about how to do that, please send Alexandra or myself a message. I'll put my email in the chat. And let's see, what else has there been? I think those are some of the main ways. So by counting the amount of youth that we have come to events, and bus operations has some more kind of general, well, and rail operations have some more general ideas about that, but those are mostly estimates. Alexandra?
Great,
Yeah.
thanks for calling a friend there. So I'll turn it back over to Alexandra. Thank you, Gabriel.
yeah, I think as I mentioned before, yeah, we do kind of keep track of those numbers in terms of community engagement. But in our department, we keep track of the cards, the ID cards that we print every year. And last year alone, and of course this is a very small percentage because only a few parents want a card for their kids. But last year in 2025, we printed about 1,000 cards related to youth. So under the youth discount. So you know, those kind of that's the kind of data that we try to keep track of. But as Gabriel mentioned, in terms of ridership, is hard to keep track of those riders.
Yeah. 1,000's more than what I thought you would do, just because people can use their like school IDs. But anecdotally, I have 2 kiddos under 19 or 19 and under, and they've really appreciated, or I've really appreciated Zero Fare for them. So thank you. Kevin, we're going to move on to you for like, how do you all measure success? Is it ridership or usage? Like, yeah.
We definitely have our quantitative measures of how many riders we have, who registers a pass, how many trips those people end up taking. And we can even start to be a little more nuanced than that in terms of how long is it between registration and someone's first B-cycle ride, or does someone sign up in December but then not use it for the first time until April when the weather is nicer? So we're able to look at all that information. And then more qualitatively, we have a number of times throughout the year that we'll often offer either very short writer survey feedback opportunities or a more extended form one that we tend to do later in the year. And it's always fantastic if someone wants to take the time, not required, to fill out a more qualitative measure of how did B-cycle impact them? Do they have a great bike share story about how this mode has helped them, for example, connect with transit or make the bus more useful because they're able to use a bike once they've come into Boulder, something like that.
Great, thank you. So I know that we are almost at time, so I'm gonna ask the panelists one more question. And it's basically, if you could remove one systemic barrier, what would it be? And it can just be like a short, like one systemic barrier would you remove? And before we get started with that, I just want to point out that there's lots of good information in the chat. There's links that people had referenced. Nick had put the 2 live events that we have coming up at CPWD, and Kevin had put information on how to request a fob if somebody doesn't have a smartphone. So Kevin, I'm going to start with you on this, but like, what's one magic wand, remove this barrier thing you would do?
I wish we could remove cost as a barrier. We operate as a company with a very public mindset, and we think of this as a public bicycle sharing system. And we're also operating as a private entity without subsidy. So we need to make sure to cover costs of doing business, but I do wish we could see the full impacts of how this would operate with either free or very low cost access.
Great, thank you. Pauline, what's one systemic barrier you would love to remove?
This is a big one, and I know it, but I really wish that we could address the issue of inadequate infrastructure. And, historically, there was a discriminatory planning in certain areas, right, that restrict access to essential services and opportunities for specific populations. And these barriers often have stemmed from historical top-down planning that prioritized highways over public transit, right, which created transportation deserts, and that primarily has impacted marginalized communities. So if I had a magic wand, I'd figure out, because the largest communities impacted were low-income individuals, people of color, people with disabilities, and older adults. So yeah, it's a big wish, but that would be
That's a good one.
mine.
Yeah, great, thank you. Alexandra, what's one systemic barrier you would remove?
Okay, well, first of all, I couldn't agree more with Colleen and Kevin with those two. But if we're thinking from the perspective of, discount programs and special discounts to help underserved populations, I would say having a self-certification process, an easier and faster process for them to get access to those discounts. That would be, the magic, where the magic would happen. But, of course, all of that requires other pieces that need to be put in place. So
Great. Well, thank you so much. I really appreciate all of you and the time that you've shared with us today. I know that some people are hopping off, but just a reminder, we will post this on our YouTube channel. And just another big round of applause virtual for Pauline, Alexandra, and Kevin. We appreciate all of your insight.
Thank you all.
Thank you.
Thanks for having us
so
today.
much for having
Yeah,
us.
thank you. Bye.
See y'all.
Bye-bye.
See you soon, Angel.
Everyone.
Bye.
Bye. And I'll stay on if anybody wants to download the chat.
Thank you.
Thank you, Nick, for stop recording. Bye, Joseph.